healthcare systems reforms is at the core of the EU economic governance mechanisms. And the reason, therefore, is that on the one hand, that a lot of public money is going around in the healthcare sector, and on the other hand, that there is room to improve cost effectiveness of the healthcare systems. The most important impact on healthcare systems, we can see it in the countries that are subject to the financial assistance mechanism of the European Union and that receive money from the International Monetary Fund together with the European Central Bank and the European Commission. Here, these countries, and this includes Cyprus, Greece, Portugal, Ireland and Romania, they have been obliged to have enormous healthcare system reforms. These reforms, on the one hand, they were aimed to improve cost effectiveness of the system, but we see that also they had to do reforms that were purely budget cuts. They had to reduce the salaries, they had to reduce the number of healthcare facilities, they had to reduce the benefit packages and to increase user charges for the patients. And this has had an impact on access to care, on quality of care in these member states. We see that also for the other of the 27 member states, Europe tries to increasingly intervene in how healthcare systems should reform. This is done through the European Semester on Economic Policy Coordination, and we see that a number of member states that through this mechanism of the European semester receive recommendations on how they should reform their healthcare systems is increasing every year. For 2014, there were 16 member states that received a recommendation on reforming their healthcare system and to improve cost effectiveness of their system. Furthermore, the instruments to make these recommendations binding have been increased year after year. So member states are more than before obliged to implement what the instructions from the European institutions, what they are. What we see within these recommendations as well is that there is basically an imbalance between the financial objectives to control public expenditure on healthcare on the one hand, and the objectives of access to care and quality of care, which are the basic objective of the healthcare systems. So there is this imbalance both in the instructions that the